What if the key to healing isn't in your head? It's in your body. Dr. Neha Christopher is a dance movement therapist, PhD researcher, and co-founder of the Indian Association of Dance Movement Therapy, and she's doing some of the most exciting work in the field right now. We're talking cortisol measured through hair. Yes, you heard that right, hair. Treatment-resistant depression, first-generation unlearners, which we really get into, and why play might be the most underrated therapeutic tool on the planet. Hello, everyone. Welcome back to another episode of Movement Meets Therapy. Today, I'm so happy to be joined by Dr. Neha Christopher. She is hi.
Hello, everyone. So good to be here.
I'm in New York, and
I'm in Melbourne. So all the way other side of the world, different day, different time.
It made it work. Yeah. Totally opposite ends of the globe. Yes. So Neha is a board-certified dance movement therapist, registered creative arts therapist, and educator whose work bridges clinical practice, research, and social engagement through the creative arts. Over the past decade, she has cultivated a global practice grounded in embodied therapeutic processes and a deep commitment to accessibility, ethics, and cultural sensitivity. And her LCAT is active when she's stateside.
Yes, it can be made active.
Yes. And she is also the co-founder of Indian Association of Dance Movement Therapy.
Yeah.
Nice to be here. And Neha and I first connected because we are both graduates of the same creative arts therapy program, and just so happy to be here.
Yes. Lovely to always meet people who've, danced on the same dance floor as you, dance studio as you. Yeah, it's always special.
Always special. So curious, I ask every dance movement therapist that comes on here, what brought you to this profession?
Yeah. It's definitely, been a personal journey. I believe this very firmly that dance completely changed my life. Backtrack to me just being a kid, not knowing too much about myself, or the different things that were impacting me. And so, I had very severe dyslexia growing up, still do. And it was undiagnosed. And so, no one really knew why all of the times that I was studying hard, like it just wasn't materializing the way that should have in school. So I kind of internalized that very early on. This idea that, okay, I'm probably not good enough. And like, no matter how hard I try, it's just not going to materialize. And one of the things that I think my parents really tuned into was recognizing that I was putting in a lot of effort, but I wasn't seeing results. And so they introduced me to every possible art form as a way to kind of compensate and a way for me to find something that I just felt like I was good at. That's really just as simple as it was, but also still so profound, right? And so what we did was I went to dance class, I went to art class, I did like a lot of drama school kind of things as well. And I experimented a lot with different art forms, but nothing empowered me the way dance empowered me. And that's really just the hard truth. Like when I would go to a dance class, I would come out and it would just change the way that I felt about the day, about my capacity, about what is possible. And, that is really, it was a radical shift in my life, like in the life of a 7 or 8-year-old, as you can imagine, like just starting to feel like, oh my God, I'm not a loser. Like I can actually just I just need to move, and I need to be in a room where I can play with my body and experiment with what my body can do or can't do, and do it in a playful way, and do
So
it in a supportive environment. Say that again. I lost you.
I resonate with that so much.
Yeah. It,
So much.
yeah, and it was just, it truly, truly just changed how I can see myself now. It changed my self-perception growing up. And I did do a lot of things. So I think part of it is arts in general, but also recognizing like the impact of actually the physicality of dance. There was really something about that helped me particularly in my growing years. And eventually, I continued to do not so great in school, and I really just thought I could only just be a dancer. Like there's no other option. And then my mom, she found a newspaper clipping about dance therapy, and she showed it to me once, being like, "Oh, do you know there's this thing called dance therapy?" And I said, "What is that?" And that was it. After that, there was no turning back. And I then pursue different ways in which I can learn more about what dance therapy is. And then once I experienced it, I was like, whoa, this is magic. Like this is not just fun and technical, but it's actually, there's something more transformative about this. And I think once I had experienced that, there was really no turning back. And that was my journey from you know individual self-doubt, you know, parents recognizing that there's something here that can be tapped into, exposure to all art forms, recognizing there's something about the physicality of movement that's so different.
Mm-hmm.
And then from dance to dance therapy.
How young were you when your mom showed you this clipping?
This was in year 10, year 9 or 10, I believe. So I don't know, I would have been 14, 14 or 15.
That is fascinating that you learned about it like as a preteen.
Yeah, yeah.
And like I didn't learn about it till college. So that's really, how did you learn dance therapy when you were that young?
I think because of the dance training that I was in this, kind of advanced dance training in a particular dance school. And they had, they did a lot of dance classes with people, on the spectrum, autism, ADHD, cerebral palsy. And we did a lot of dance teaching there. So I think in a way, why it landed so early for me is because before I was able to also experience it in my life, I was able to see the physical difference that dance helped with, like activities of daily living, right? I didn't have that terminology when I was a 14-year-old kid, but I could see that somebody is able to walk differently or eat differently because they've engaged in a dance class. And I think that that is what solidified very early on for me that, okay, this is potentially what dance therapy is. um I didn't understand it fully till I think at when I was 18, I did this diploma in creative arts therapies, which was, I think, along with 18, I think, my first year of college. So along with that, and it's a bit different in India. The years, you're a bit younger anyway. But yeah, so at 18 is when I actually did that diploma, and I was introduced to like the formal modalities of it. But before that, when I read that newspaper clipping and I saw what I was seeing in the dance classes, I was like, oh, this is what it probably means. It probably just makes your life easier and better. That was my simple understanding of dance therapy, because I could see that, okay, somebody with cerebral palsy is able to then press their own button on the wheelchair after dance therapy. Like that didn't happen before. Something as simple as that. So like I had a very simplistic understanding of it, which I think I've circled back to after all these years. After going very technical and very like jargon heavy, coming back to actually just it does help make life better in some ways. And that's, I think, a big part of what we do.
What are things that you love about your current job, your current daily schedule as a dance movement therapist?
Mm. I love um, the schedule bit in that, right? Because I feel like as a therapist and
There's a lot
as a
going on.
right, exactly. Like as a therapist in private practice, oh my God, sometimes your schedule is jam packed and you're working 6 years a week, and sometimes you're working 20. Like it just is this ebb and flow rhythm. Um,
Yeah, it waxes and wanes.
it really waxes and wanes. It really is very like moon-like, like, oh, okay, we are now in these different phases. Um, yeah, what I do love about it though is how embodied I am. Like, I know it's kind of like the selfish perspective, but so I work two jobs. One is, at an institution where I teach into a master's course. And that is, teaching focus, and I am still embodied there, but embodied in a very different way in my private practice when I'm actually doing the work with clients. And I think, like, on a very personal, selfish level, like being embodied really fills my cup. And if I have to think about what I like about that, it's living a life that I feel is more aligned and authentic. Like I don't feel empty. Exactly, like I don't feel empty in my body. And I know this can sound woo to some people, but that's what happens. Like if I'm sitting on the computer and typing all day, like I feel that cognitive dissonance because I was not meant to be this person who's sitting on a laptop and typing all day. I was meant to be a mover. I was meant to be someone who's in my senses and in my body. And I definitely love that the most about being a dance therapist, and whatever that looks like, because it can look like so many different things. But the fact that I can just be embodied, I think is the most favorite part of my routine. And I genuinely miss it if it's not there. Because I do feel like it's just so grounding.
I'm really curious, what did you write your thesis on?
My thesis was on this clinical population of treatment resistant depression. And actually, it was the first study in the world that was done with this population in dance therapy. We've had a lot of research on depression and anxiety, but we have not had any research come out on treatment resistant depression. So that's the kind of depression where you've done the things, you've been quote unquote treatment adherent, right? Like you've gone to the sessions, you've taken the medication, but it's still just not landing. You're not feeling better, you're not experiencing the benefits the way that you thought you might. And that's treatment resistant depression. So it's kind of a further marginalization within already having a really tough diagnosis of depression. There was no research done on that subset of depression. And so my thesis, wild actually, right? Because even I assumed there would, because there's so much depression research, but like this particular subset, there just wasn't. So my study was the first globally, and it felt like a huge undertaking. But that's why I guess you have 5 years for a PhD, so that you can really go into that kind of stuff that hasn't been done before. And in my thesis, what I did was I did 3 different studies across my research, and I kind of weaved a story across those 3 studies. So 2 were preliminary studies to kind of get some data because there is none. And then I created a protocol based on those preliminary studies and what I call the dance with data. So I did this movement experience. I know it's like, nerding out, right?
Such metaphor.
I know, exactly. But it was really just like an absolute thrill. And dancing with the data was essentially basically me moving in response to the findings of study 1 and 2, along with my reflections on practice and I had a witness who was watching, but it wasn't an authentic movement type of witness. It was just somebody witnessing. And then after that, I integrated all of that movement practice and the insights I got from movement back into what I potentially thought could be beneficial in the intervention. Then did some more research on whether this is a fair enough protocol. They created that, tried it out, and it actually worked, which was incredible. Um, yeah, so
No clue what you're talking about. What does it mean that it worked?
so I was testing to see that, with people who are experiencing something like treatment resistant depression, right? You have chronic stress because you've already tried to get better. You've done all the things, but it's not happening. So one of the areas that I was working on was to test their cortisol levels, but not cortisol through blood or saliva because that's more short term. I was looking at cortisol in hair. So I actually took hair samples and we tested the cortisol. And every 3 centimeters of hair gives you cortisol data for 6 weeks. So we were able to backtrack cortisol across time and see that actually dance therapy helped reduce that long-term cortisol, which is that hypothalamus overactivity. And so that was one beautiful finding, which is that, okay, in 12 weeks, people who've been chronically stressed because of their illness and because it's hard to live with such a tough illness, they actually reduce their hypothalamus and pituitary axis overactivity, like that reduced with time. And the other thing is that body trust increased, which was a beautiful one. And this was through interoceptive awareness. Like that's what I was really focusing on. If they can, if tuning into that is one of the ways to manage this chronic stress and treatment resistant depression. And it was beautiful to see that, like just trust your body a bit more. It makes me emotional thinking about it because like I don't think people realize what a gift it is to trust your body. Like if you have it, you don't know that people are actually desperate for it, like especially in in chronic stressful conditions. So that was one of the most beautiful findings of my research as well, that like you can actually trust your body more in the midst of so much systemic oppression, in the midst of so much strain, in the midst of like trying hard and not seeing effects. Because you start to think, okay, maybe I'm not doing things right, when you're in that kind of a ongoing cycle. But it shifted with dance therapy, and that is what I mean by it worked.
That is the most incredible thesis, I think. Well, first of all, the hair and the
Yeah.
testing. Were the participants okay with you getting their hair?
Yeah, it was part of my informed consent, and they were actually very thrilled by it. They were so excited. And what I did is to just make it a bit more equitable and not like, this weird kind of dynamic with the researcher and the group. Is I also cut my hair so that, it was like, okay, we're doing this together, kind of just to spread out the power a bit. And that's how I excuse me, that's how I showed it to them. I was like, okay, you take this and then and like this is my sample. And
You're
it was
them. You're modeling, which is what dance
yeah.
do. What would you tell your younger self right now
Ah,
who is doing all that work for such a big deal illness, by the way?
how old are we talking? Which younger self?
Maybe the you that was just starting to get amped up and excited about helping people that are treatment resistant.
Yeah. Um, I think I would tell myself that it works. It truly does work. It's not something you're making up or imagining. because I think at that, at that stage of my career, I did have some questioning about the efficacy of dance therapy. And not necessarily because I believed it from a large scale perspective. I just thought it was so personalized. And because I didn't trust my own observations of what I was seeing in sessions, I didn't trust my own capacity to hold space for healing. And
Right.
so, because of that, as a result, I doubted dance therapy because I was doing dance therapy. And so, I really think I would go back and tell my younger self, like, it works. And it works because you're doing it, it works because you care. And I think that's enough to have kept me going in a way that trusted myself in a very different way.
Do you use music in your sessions now? Or is it
Um, not not as much, I think I used a lot of movement early on in
music?
my career. Yeah.
Mhm.
Just I think because I think I needed it for myself to like get movement going, or I think that's what I assumed you had to do, even though of course we're taught, right, that you don't really need music and the body is all you need. But I think I used it a lot early on in my career. I also worked with older adults who had a lot of positive association with music. So
Nice.
it, yeah, so it was purposeful at the time. Like it had a reason. There was a reason to do it in the way that I did it. But with time, the people I work with has changed so drastically that I don't always use music. Sometimes I use music, especially if I'm working with people that we don't have a common language.
Mm-hmm.
Then I'll use Google Translate to ask them to like pick a song or something so
Oh,
that they feel a sense of empowerment. And then they just have agency, right? To like pick the music in the session. And then that is the language that is leading the session and not like me trying to speak in a broken language that I don't understand. So I think that's also changed that now I use music much more in a much more nuanced way than I used to. It's not like an automatic thing. I don't assume I need a playlist anymore. Um, I think the last time I made a playlist was like during COVID. Honestly, I don't even think I have like an active playlist. I just like look up things randomly. And that's something I learned from Alyssa. I don't know if like in your classes, like she would just have that flip book, right? Of like CDs. Just
yeah.
like go with the vibe and just like, and I never knew that like I would ever reach that ability of trust in like my music selection. But I just don't feel like I need to go in with a playlist anymore. Sometimes I'll literally just look up music during. Um
Mm-hmm.
and fine. So the I guess the short answer is I don't always use music. I definitely used to because it was a way of supporting my own self and the client need at the time because it was older adults who just loved Johnny Cash and Neil Diamond. I was like, yes, let's do it.
Yep.
But like now we don't need that, unless it's a language thing, and then I sometimes use music as like part of the rapport.
You have this expression that you use, first generation unlearners. And that really tracks with me because that's kind of the population I work with in my private practice right now. People that are self acclaimed black sheep of their
Yeah,
family, or they are the cycle breaker in their family, and there's a lot of pulling
exactly
apart
that.
of
Yeah,
energy.
that's it. That's what it is.
And it's like releasing a lot of stored tension.
Hmm.
So tell us more about first generation unlearners because maybe I think we both are that also.
Probably, I think most therapists also, not just dance therapists, may possibly be that. Um, oh my God! So this is a term that I think it's not a term that I've coined, but it's just become so much of my practice, which is why I've started trademarking it. Um, During I think maybe 2018 or 19 maybe, is when I started noticing this trend in my private practice, which is that people who were coming to me and asking the questions, right? Or, or like this desire to like live a different way, they were very often the first in their family to do that. And over time, we learn these things about unique marginalizations, of like unique stressors that, like, depending on where you are on the intersectionality lens, you have very specific types of struggles that you go through.
Mm-hmm.
And what I was starting to also just track for myself was that a lot of the people that I am working with are navigating trying to live a new way without knowing how to do that, trying to break a cycle, like you were saying, without knowing what it means to actually live more wholly, right? And it was all cognitive. Like
Yeah.
all of these people came with these ideas, right? Of like, I want to have different boundaries than my family, or I want to speak kindly to my children. I want to do like gentle parenting and not be abusive. I don't want to have that toxic stuff. So that there was a lot of like cognitive ideas about what I want to be, but there was no role modeling, there was no visual input, there was no embodied input. And for me, like those three things became the pillars of the work that I was doing.
Mm-hmm.
That, through images or metaphors or visualization, we're imagining what this can look like. We're embodying then what it can look like. And then then we're making also like tangible plans of like, okay, this is how we can try some things.
Yeah.
Um,
Taking
right?
action.
Exactly, in action. So a lot of kind of like that translation from the cognitive to the visual to the embodied.
I love how you
Um,
add the cognitive to the visual to the embodied.
yeah, yeah,
All of the visual also as well. So
yeah,
it's this inserted step that's really the art. It's like, I mean, at least
exactly.
really just up to you how creative you want to go.
Absolutely. Yeah. And that's when I realized that that's part of my niche, that this is actually what I'm starting to offer. That it's not this like generic thing, because I used to describe my private practice as like working with a diagnosis.
Mhm.
And I really no longer do that. Now I really describe it as that experience that, look, it may manifest as any diagnosis, right? You may have anxiety as a result of this, navigating this life transition. You may have depression. You may have any sort of mood disorder, or or it may not be a disorder and you're distressed, right? It can be anything, but the that is just a symptom. The symptom is not really what I'm working with. What I'm working with is navigating the experience underneath the symptom. And so I think I found language for that after a few years into my private practice. Right, you're like, woo.
This is root cause stuff, people.
Yes, yes.
Root, like
Yeah.
ancestral shit.
Everything, right? Like cultural, um also like epigenetic trauma, like all of that stuff. Like these are words people throw out on Instagram and TikTok nowadays, but like the way you recognize that is through this work. It's the only way to change it, because you don't even have language for it, right? So how are you going to talk through it?
Yeah, it's like so scary. It's like you're sending someone on a journey without a map.
Exactly. And the map is really, your nonverbal cues. So I think I now go hard on, just even when I'm doing like discovery calls with clients, or anything where I'm trying to see if we're a good fit for one another, I really focus on naming that experience and saying that, look, this is the experience that we're gonna get into as a starting point. Of course, we'll start as softly as people need. Um, but that's the experience, and very often also the goal I found that first generation unlearners have is to find a quieter mind. Is that very often first generation unlearners are trying so hard to understand their experience, are trying so hard to name their experience. The mental load is so internal and heavy that their mind is not always a safe space. And, focusing on creating a quieter mind, like through the body work, is a big part of that unique experience of being a first generation unlearner that I really now like confidently tap into in my practice. But it's been a journey.
There's so much I want to ask you about this. Does your early dancing, like when we went to school, it was called your movement repertoire. Does your early dance training inform your work now? And if not, what do you feel like you're actually moving this now? In a
Yeah.
way now?
I do think so. So I was a hip hop dancer. That was like the style that I did. And even if you think of the history of hip hop and how it's rooted in black resistance and this reclaiming of things, right? And so of course I'm not black, so I don't connect with it in that same way. But I have benefited from it as a dance form that is rooted in resistance and power and reclamation.
Strength, like
Rhythm, right? Just
oh,
that like consistency. And if I think about, like, again going back to that first generation unlearner bit, right? It is the consistency of the body rhythm that breaks the inconsistency of the thoughts. Like there's just all of these different, like, too much happening in the mind. And it's when you come in with that structured rhythm, things that is so often offered in hip hop, that you can offer some containment to these wild chaotic thoughts, that any first generation unlearner is potentially navigating. And I recognize, of course, that I was one too and still am in so many different ways. But I think the physicality and the rhythmic nature and the political and historical roots of hip hop as well have influenced kind of like my approach in dance therapy a lot as well. And then eventually I moved on to salsa because I had this crazy back injury, after which I couldn't like do hip hop or really dance performance anyway. And then I also use salsa a lot in kind of the in reclaiming a different type of body trust, right? Like the sensuality and trusting the fluidity in the body, right? So in so many ways, like both my dance trainings, right, like the hip hop and the structure, the salsa and the fluidity, like they both offer exactly what I need in my practice. So I think they've directly, like, for me, I can see a direct like through line between my repertoire and the way that I practice and hold both rhythm and fluidity.
oh, this is so juicy. I love this. Like you have the Venn diagram, you have the hip hop and the
Yeah.
salsa, and you have the direct and indirect, and
Yep.
you have the balance, you have the fast and slow, you have the sharp and the smooth, and it's just
Totally.
like we love. I sometimes feel like dance movement therapists are like bakers,
Yes.
like we're baking something with our clients. It's like similar with drama therapy because
Mm.
I recorded a drama therapy podcast with another
Yeah.
colleague, and she's doing like, you're making something brand new
Oh yeah.
for the first time. And that's the thing with dance. Obviously, we know it's very fleeting, it's very transient, it's its own art form, it's different from any other art form. And there's
Mm-hmm.
a lot of punctuation, or maybe just using one part of your body and noticing where you're stiff. And like you said, you had an injury, so you had to work around that. And then like you notice other patients are coming into your life and you're like, oh, maybe they have an injury, and you're able to help them and like have that empathic
Yeah.
awareness and like attunement that you didn't have before your injury. So it's like you're just constantly a vessel.
Absolutely. That's just it, you know, like you are a vessel. um and I think that's why it's hard work, you know. I think people don't realize like how exhausting it can be to be a vessel and be tuned in. And I think this is why it's tiring, and this is why it's also fulfilling, right? It's that kind of yin yang thing, but this is
Yeah.
why. Hmm. Yeah. Ugh.
It's
I
like,
just love this conversation.
me too.
Ugh. And there's something about the joy of like somebody like feeling it when you're saying it. You know, you're like, ah, yes. It's just really, it's just so good.
Do you have your own spirituality that you bring to your work, or anything like
Mm.
metaphysical, otherworldly that you talk about with clients?
I don't bring in consciously anything that I would categorize as spiritual, but I do think it's a big part of why I have hope in my practice, right? Because so often, like, it's tough, man. It's tough when you're just like faced with systemic shit. It's just like and
Yeah.
so many times the barriers we're up against with our clients, we're journeying with them through some really hard stuff. And sometimes we know that we may not get through to the end line because it's actually such a systemic issue that's beyond any of us, that's beyond what one person can do, that's beyond what therapy can do. And
Yeah.
so I think it's not actively something that I have conversations with clients about, but it's the reason I can have hope that it's there's gotta be more. And there's gotta be something that allows us to um, keep persisting, you know. And so I have my own faith and practice, but um, yeah, I'm mindful of not kind of letting that
Hmm.
take forefront. So I haven't figured out a way to kind of, you know, do that yet, where it is not taking focus, but it's still kind of mentioned. So I haven't figured out that magic yet, but it's definitely part of what keeps me grounded and keeps me hopeful. Like hope is, I think, the central word there. Um,
Yeah. Hope is also the first stage of the Erickson development.
that's
We
true.
It reminds me of, because I have an online program and I use the 8 stages because I was so obsessed with it when we learned it in school. And I made a dance therapy like
Equivalent.
equivalent of the whole
Oh my
out.
god, tell me more.
So I did every phase of the Erickson 8 stages, and I made meditations that go along with it that people could use at home if they want to tap into hope or love
Oh,
or generativity, you know,
I
self,
love that.
just all the aspects of self. And of course, I also love parts work and IFS and using that kind of philosophy with dance movement
Yeah.
therapy because it just makes sense to me.
Mm,
We're using these different parts of our shadow and
yeah.
part X and, just we contain multitudes.
Of course. Oh, yes. Oh my goodness, Rebecca. I am waiting to look at that and just download it. This is so great.
Yeah,
Oh,
I'll
well,
send you the link
incredible.
in the show notes.
Yeah.
Yeah, no, it
Oh,
took
I love that. I love that so much.
a long time to make. Really glad
Of
I did.
course, I'm sure. Oh my goodness. This is the thing, right? Like translating anything from like the psych world into our world, whatever that means, it takes so much work because you're up against this like presented evidence-based form. However, these are all theories that were just created by like white dudes back in the day. Like it's not like, you know, we don't actually these are not actually fully evidence-based things. Um and this is the same thing that happened I don't know if like the listeners are aware, but like one of the things that we have like leaned hard into as the theories um, is this concept of depression being directly linked to serotonin in the brain, and that was completely debunked in 2022. And people were just like, oh, we just, it was a theory and we went with it, and it was just like, what are you talking about, so it's really wild. Say that again.
I don't want to offend anyone listening with a lot, like, I can go on about.
Yeah, but it was, it was debunked by this, like they did this very big review at UCL London, where the scientist was, I think her name was Joanna Moncrief, and it was a huge team. And so it doesn't automatically mean that antidepressants don't work. That's not what it means. It just means that what we've been assuming is the serotonin reuptake theory that needs to be re-questioned. So it's one of those things where, it's science is constantly evolving. And I think that's the beauty of science, that it is evolving. And so we have this chance in dance therapy to keep, questioning existing theories and adding to them like you've done. And I think this is part of the beauty of working in a field that is expansive.
So what was the serotonin thing? Is that actually important when it comes to diagnosis now, or is it something else?
I think what it opens up is more questions, because we've assumed for the longest time that it's having to do with your serotonin reuptake inhibitors in your brain. That a different functioning of that has caused a different level of serotonin, which is what is causing depression. But what the review basically said is that we need to re-question this theory, and say that it's not always directly linked with that. So it doesn't mean that you stop taking your antidepressants or anything. It just means that, again, when we think of root cause and when we think of what is causing depression, the theory that we have built so much of our understanding of depression on actually does not hold good, in so many ways. And this is, for people listening, it's a so the author is Joanna Moncrief, 2022, I believe, and UCL London. So it was a big review done by them. And it really, I only learned about it because of my PhD, because I was looking at different theories and like how they were being reevaluated with time, as it should, right? Every theory should be reevaluated with time. And that's when I learned that this big monumental thing happened in the field of depression. And we need to be aware of it, right? Because still people are just saying, oh, it's a chemical imbalance. But yes, and there's more, right? Because that's being questioned. And the other thing that's beautiful about that is now there are other theories also that like depression is an illness of power and depression is an interoceptive disorder, right? These are new theories that are coming out. So I think like we have to just hold both together, right? That, okay, this existed in the past, it's evolved, it's being questioned, and then now there's new stuff. And what you're saying from the work you've done with Eric Erickson's theory as well is just like beautiful, because I think that's what we need to do. That's where we are in the stage of development of our field. Like, we're up against these big evidence-based things. We help them evolve and kind of move from there as well.
I also acknowledge what you're saying, that we're holding both. We're looking at both. We're not telling people not to trust their doctor.
Of course, yeah.
But it's also understanding, when you said interoception, that involves a bottom up modality. You have to go from your feet to your head, not from your head to your feet, because not everyone could handle that. And I don't think we're supposed to handle it well. I've also witnessed that this work works for many years, and measuring it has always been the hardest thing.
Exactly.
Because, I mean, you had hair, so you can actually measure hair.
Yeah.
And but like, what else is a contributing factor when you're actually watching someone dance?
Mm. Mm. Yeah.
So much.
It's like so many, right? Like so many factors. And I think social, cultural factors are one of the biggest ones that I hope that's where we lean into, like in the world of research and dance therapy, because it affects us too much for it to not be documented.
Yeah.
Like the intersectionality of the person in the room, it affects us too much for us not to name it.
And you mentioned this concept of growing up too soon in some of your work. Like,
Yeah.
I know what that means, but what is your interpretation of growing up too soon, and what does that mean for someone's body,
Yeah.
how they express themselves? Is that like, does that cause different laps in development? I'd love to talk more about that.
Yeah. So this is another trend that I again noticed in private practice, that very often, actually, it's not just in private practice. I also noticed it in my clinical work, like at hospitals and institutions, that when people would share their stories, there would be these examples time and again of how things that they experience was potentially beyond what somebody at that age or stage of life should have experienced. And I know should have is kind of, this like societal term, but it's more about also just like reasonable expectations, right? Like we shouldn't ever really expect a child to intervene and sort out a dispute between two parents. We shouldn't expect a mom who's just delivered a kid to also manage a partner who's experiencing extreme substance abuse and dissociation as a result of that, because it's too much to manage. It's just simply humanly impossible. So something that I noticed was that there was this trend of situations being so demanding that people had to just somehow pull themselves together and like rise to the occasion, right? And a few times you are able to rise to the occasion, but when that keeps happening, you snap. And a lot of the times that I witness people, when they talked about their first psychosis break, it was when it was just too much and they couldn't rise to the occasion anymore. It was just beyond their capacity. And that's another systemic thing, right? The reason people are forced to be hyper independent, are forced to just do everything themselves, is because there aren't enough community systems. There aren't enough places to go to. And so I think growing up too soon is a result of systemic failure. Regardless of which country we're in or whatever, I think it's like a community systemic failure thing. And a lived experience that comes out of that is often hyper independence, is often people pleasing, right? Is often that fawning in the flight, fight, freeze stage where you're just trying to appease people. It's often not actually knowing what you want and just constantly monitoring the emotional tense climate in the room, right? So that you're just always keeping track and making sure things are okay. And as a result of that, you become internally so fragmented, right?
Yes.
Because
Fragmented.
yeah, so and that's again, it's a term I've intentionally used because I don't want to focus on our diagnoses, right? As a result of having to grow up too soon. Maybe a parent died and you had to like rise up to the occasion. And in India, this happens a lot because, of the patriarchy in certain parts that the clients that I had worked with were from, especially if you were a young boy and if your father died, you were now the man of the house, right? And this is too much for a 12-year-old kid. But that's what happened. They just rose to the occasion. And through that traumatic event, they grew up too soon, right? Or they at least presented like they grew up too soon. the same thing with really young moms who, who were forced into, having or going through the pregnancy in certain spaces, and then they just grew up in overnight after delivering a kid, except that there was still that inner child left in them. And so much of my work then is just comforting that inner child, right? And it is about allowing some play in sessions, allowing there to play to literally creep in step by step, because play feels so unsafe because it's unpredictable,
I like how
right?
you
Yeah, like, because it's
calling.
so, yeah, like literally titrating play into sessions is part of the work, because play is terrifying for people who grew up too soon, because it's, you can't control it, it's unpredictable. But
Yeah.
that's actually how you heal, right? Like the antidote to depression is not depression work, it's joy. The antidote to growing up too soon is is play, so I think that's really the experience that I'm working with, when I say, like, I work with people who grew up too soon, and it can happen at any age, right? That's the other thing with that. Like, if you think you're supposed to live a certain life in your 30s and then something happens and you've jumped a decade, that's still growing up too soon. If something happened in your 50s and you've jumped, years, that's still too soon. If something happened when you were 12, so it's very kind of age diverse, my understanding of what it means to grow up too soon. It's more about the experience of, I wasn't expecting this to happen so soon. That's that internal dialogue.
Too much too soon.
Yeah.
Helping the client, staying with the mover in the space and holding space. I love how you said in the beginning of our conversation, you remember not being able to trust your capacity to
To
hold
hold
space,
space. Mm-hmm.
but it does really for me personally, I think it comes with like attitude and practice, and like you said, play, titrating play, and play means different things to different
Yeah.
people, and
Mm-hmm. Mm-hmm.
that cultural delineation between everything. And it's just, I was just talking about this with someone, that play, and I learned this in a trauma training, that play requires empathy. You have
And
to put
empathy for yourself, which
right.
people, who grew up too soon, it's too scary to have that. Because the minute you need to empathize with yourself, you need to recognize the magnitude of what's happened.
Yeah.
And that's like, it's too confronting, so it's there's so much behind the theory of play, right? And like, sometimes people look at us and think, like, what are you doing in sessions? And you're just like tossing a ball for fun. It's like, but if you could understand exactly,
It's a
like,
little,
the stuff behind that, like, the this person tossing a ball is radical.
well, you also just made me think about how famous comedians are often like very depressed people
Yeah.
behind the curtain. They're like, they have to push themselves and they'll go to the edge. And that's what it is. Like, they're confronting those shadows
Yeah.
and throwing them out there because it's actually funny to say it in a certain way, or a
Yeah.
certain, like, it's all about the environment in a lot of ways too. You know,
Mm-hmm.
like, you're putting
Yeah.
dance on a stage, or you're putting it in a parking lot, or you're putting it in someone's bedroom. Like, it just opens up so many worlds of where, like, oh, I'm here with my inner child. My inner child is with your inner child right now.
Yeah.
Yeah.
Yes. Oh my goodness. Yes. Uh, yes.
I think we could keep talking probably for a long time.
Yes. I am just like thrilled with this conversation. Um, and there's something to say about that, right? Like, I guess there's not enough spaces where we can be enthusiastically, like, joyful about, like, I'm a dance therapist and this is what I do. Because it's hard work and sometimes it's so exhausting that you can't actually hold that all the time. But spaces like this are good because it helps you get back in touch with just, yeah, this is why I did it. This is why I believe it. And like it's nourishing at the end of it. It's really truly nourishing.
Yeah.
Um mm,
I find that with this work, you're always giving it your all, and you don't have to second guess that. You know that you're putting your heart and your soul and your dance into it.
Dance, that's fully true. You're putting your full dance into it. Um, absolutely. And you're able to do it in different ways, right? I think that's what's also incredible about it. Like it doesn't have to look a certain way. And I think that's truly just, it's so gracious. I find it like a very gracious thing that it can really look very different. I know for me it has looked different over time. I also live with a chronic illness, and it's tough for me to sometimes move, like actively move through space, but I'm still moving.
Yeah, me too.
And so allowing myself to remember that movement will look different for me, and it's still movement and it's still good enough, and it's still dance movement therapy. There's something about leaning into that creates an allowance for our clients as well. I find, do you find that as well?
It's just the most human therapy I could think of.
Mm,
I think it has its place. I like a lot of other therapy.
mm,
Thing about walking into a dance movement therapy session and you're already thinking, oh, it's not just my thoughts and my words that matter. That's like such a small piece of this whole thing. Like I'm a whole universe. Yeah. And like if this therapist who says that she's embodied, that means that she's not gonna just say something to say it. She's not gonna like bullshit me. She's not gonna just say something because she learned it
yeah,
in
that's
school.
true. Yeah, absolutely. Oh, that's right. And that's the trust bit, right? That like I guess it, like when you think people are able to feel like, okay, they're not going to bullshit me. It's like, okay, there's actually scope for trust in a very different way. Mm.
How do you, if we could leave off with just one patient that you're working with right now and just like bring us into that session
Mm.
for
Bring us into that session.
like for 3 minutes
Mm.
or 2 minutes.
So I can maybe think of a client that I'm not currently working with, just because I think
Yeah,
yeah, with
that's
time and tracking and things, it I don't want anyone to put two and two together, basically.
yeah, no, of course. Maybe correction. Someone from the past that's not you're not working.
Someone from the past. Um, um, yeah, I can think of one client actually who uh, who I worked with for almost 2 years, in a particular setting, in a particular country. And the work that we did was very much focused on naming different things in the body. And that was step one of her body trust. Because very often she would say, like, how commonly we ask, how are you feeling? How are you doing? And she'd be like, I feel all these things, but who even knows if it's real? Like she would often say that.
Yeah.
And, part of that shift, right, from the cognitive to the visual to the embodied was starting to name what each of those feelings were and just try to believe it. Like first we're just trying to believe it. And then eventually she did believe it because it kind of like helped that neural loop happen so often. And slowly we're starting to tune into each of those feelings and not just naming them cognitively. So maybe we can end with that, just like naming
Yeah.
what we're feeling, because that's often the first step of body trust. And I remember it being such a clear shift in this client's journey because there was so much confusion and mistrust about who even knows if it's real, like casually throwing it, but there was a hint of truth in that. And then followed by later on when you would ask her how she's doing, I'm feeling flutters versus who even knows what's real. And it just started with something as simple as naming what you're sensing in your body. So if I had to name what I'm sensing in my body right now, I'm sensing heaviness in my legs, but it's a comforting heaviness, like a weighted blanket kind of heaviness. It's not heavy. Um, there's some lightness in my stomach, but that's because I haven't eaten yet, I think. And I'm also excited. I think it's also like my nervous system being excited to have this conversation. And I'm also noticing some tightness here. And the feeling I'm feeling is actually joy, feeling a lot of joy, to name that as well.
Neha, first of all, I would love to dance with you one day. That would just be so
Yes.
great. And do some, you're so on the other side of the world right now, but when two embodied people can meet and share, and I'll just share, I'm feeling very open across my whole solar plexus, and it's just this like stream of just clear energy speaking with you, and I feel almost like another like weighted blanket feeling, but like between my shoulder blades.
Mm.
Like it's like grounded, and then it's going down the back of my legs, and my legs are kind of sore, but then it's like rooted like two little roots into my
In
heels,
there. Yeah.
like down.
Mm. Yeah. It's the way you're describing the visual of that is somewhat similar to that heaviness that I'm describing in my feet as well. And I find that so beautiful that we can sit in two parts of the world, talk about an embodied modality, tune into one another unconsciously. Obviously, we're both trained to do that. And then end with some sort of similar, like, lived experience in the moment. Like, that is just gorgeous.
Oh, if only we can all do that together, and we would have less war.
Oh
Right.
my goodness.
Whole thing.
I mean, truly, it just, what a gift. What a gift to be able to tune in and have like a human experience that's like beyond this 2D thing in front of me. Wow.
Yeah, and even when I close my eyes, I could just still feel the whole conversation that we just had, and just feel like how happy it is. It's a celebration of our work and how much love and energy and time we've put into this belief
Absolutely.
system, because it is another belief system that dance
Mm-hmm.
movement therapy can transform lives for the better.
Absolutely. Big believer of it.
Yeah. Well,
Yeah.
where could our listeners find you? Where could they connect with you? Is there any last little glimmers of hope that you want to shine on people before we
Hmm.
die?
I think just Just a comment on how people can connect with me. My website is just my full name, so nehachristopher.com. There are different ways that we can engage there. And that's, I think, a good starting point. And one of the things that I've just put into my website is this idea of the invisible backpack, where I've started to start naming the different things that, people who grew up too soon or are first generation unlearners are probably carrying around without noticing. So if it resonates with people, um, you know, that's just a little interactive tool. It's not a diagnostic tool, of course, but it's a way to name the implicit things. And sometimes that can just give you language to know how to have conversations with people where it's maybe going to help you move to the next step of your healing as well. So that can be a way to engage for, people's own self-discovery. But all of the things that I do in different parts of the world is all updated on my website. So that would be a great place to start off.
Thank you so much.
Thank you, Rebecca. This was so fabulous. Thanks so much for holding the conversation.
Okay. Thank you all. See you soon.
Thank you.
Wow, I love that episode so much. It was definitely a long time coming, as Dr. Neha said. She just reminded us that body trust is not a luxury, it is the whole point. If something in this conversation cracked something open for you, don't let it go cold. Head to nehachristopher.com, explore her invisible backpack tool. I'll throw in my Eric Erickson dance movement therapy course and start naming what you're carrying. Just start naming it. It's not forever. I will also attach the nature.com article from 2022, The Serotonin Theory of Depression, a Systematic Umbrella Review of the Evidence by Joanna Moncrief and 5 other researchers, actually. So it's a really big article. We're not telling anyone, we're not doctors, we're not telling you to taper off your meds. Talk to your provider. But definitely keep dancing. We'll see you next time on Movement Meets Therapy. You already know the way. Take care.